Hello, my name is Rosie, and I am a clinical social worker at UCI Transplant. And I would like to take this opportunity to provide you with some information that I think might be helpful or useful on your journey of recovery from your transplant surgery. The transplant team's focus for you is to have you move forward with your healing process and become responsible for your new gift of life. This transition, of course, can be very difficult, and the role of the clinical social worker is to walk the journey alongside you and provide education and emotional support. The transplant team is aware that receiving this initial phone call to come to the hospital for transplant has probably impacted your life. You may not have been prepared emotionally or physically at the time of our call, and were probably filled with excitement, anticipation, and maybe even some fear and anxiety. So, I am hoping today's information will be helpful for you. So, let's get started. So, preparing for transplant. Ideally, you need to have two caregivers after your transplant who can care for you at home and drive you to your clinic visits for the next 4 to 6 weeks, due to the fact that you are not able to drive for the first 30 days. A cell phone is required to communicate with the transplant team. You will be receiving calls from different members of the transplant team, so it is important that you carry your cell phone with you at all times. So during your hospital stay, there can be some difficult moments. So, for example, there could be additional testing, pain from your surgery, frequent interruptions, and visits from multiple healthcare providers. One of the factors is that you don't get a lot of sleep due to the different people coming in and out of your room and those frequent interruptions. And I know that this can cause a little bit of stress or increase your stress level. So please contact either the transplant social worker or one of the transplant team members if that does happen for you or you do experience some increased stress. Let's talk a little bit about emotions after your transplant. So, there's a wide range of emotions that can take place post transplant. For example, you could experience some fear, and that would maybe look like, oh my gosh, will my kidney work after the surgery? And for how long is it going to work? Or maybe some anxiety due to the new responsibilities that are going to be required of you and your caregiver. You will have some new medications as well, and sometimes that can cause some stress and anxiety. In terms of depression and grief, that can happen post transplant. For an example, you may start feeling sad when you think about the family that donated the kidney to you, or just due to the surgery and sometimes different things that are happening for you. Depression or grief can initiate and start for you, and it would be important that you contact the social worker so that we could have a discussion about that and you could be assessed. In terms of anger and frustration, you could start feeling out of control. It's very hard when there's so many people involved in your care at the hospital. You just kind of sometimes feel out of control, and that can initiate some additional stress. Also, there could be some guilt feelings due to you may be thinking that you benefited from a person's death, such as the donor who donated the kidney to you. You may start feeling this lack of confidence or difficulty to make future plans because you are somewhat restricted, that first month or two post transplant. You'll be having lots of visits with different providers. There could be some body image changes after the surgery, and that's something you would want to talk with the social worker about as well. It is vitally important that you do not ignore or dismiss your feelings. It's important that you do talk to a trusted friend or a social worker because talking can help decrease stress, depression, and anxiety so that you can move forward in this process of recovery. Let's talk a little bit about writing the donor family. Writing the donor family is a personal choice. I want to emphasize that this is not something that is required of you. It is a personal choice, whether you want to write the donor family or not. Of course, there are guidelines about what may be appropriate to include in your thank you letter or your correspondence to the family that donated the kidney. One Legacy is the agency that can help guide you in this process. And as you can see in the slide, the telephone number for One Legacy is 800-423-7220. We have also provided their email if you would prefer email. In addition to this, the transplant social worker can discuss with you some of the information about writing the donor family in a little bit more detail. Let's talk about insurance. So, Medicare, if you do have Medicare, covers your medications for 3 years. And after 3 years, you may qualify for an extended coverage period. So, let me give you an example. If you've been disabled with something other than end stage renal disease after your transplant, you could be covered, your Medicare could continue. Or if you were age appropriate and had reached the age to qualify for Medicare, and if you were able to qualify for that at the age of 65, then you would be covered under Medicare. Medi-Cal members must renew their coverage each year to keep their health care benefits. It is very important if you move or change your phone number that you contact Medi-Cal as soon as possible. Medi-Cal does contact you on a yearly basis. And so if they are not able to reach you, that could cause some lack of coverage if they're not able to reach you on a yearly basis. If you lose your healthcare insurance, it is vitally important that you contact us right away at area code 714-456-8441. One of the main things that needs to be taken care of post-transplant is that if you do not have a current primary care physician, you do need to call your insurance company to either find one or have them assign one to you. Once that is completed, then you need to call the transplant department to inform us who your primary care physician is and their phone number as well. Now, if you currently have a primary care doctor, you need to inform us of that as well, just to ensure that we have the right information in our computer for your primary care physician. Well, I thank you so much for listening to me today. I hope this information was helpful to you. You can always reach a transplant social worker at area code 714-456-8441. I wish you luck on this journey of health, and please give us a call if we can help in any way. Thank you. Have a good day.